talk about patellofemoral pain, and it's basically a fancy catch-all term that physical therapists and doctors use to describe knee pain. But patello means your kneecap, femoral means the bone in the thigh and your upper leg, and then obviously pain. But again, it's a catch-all term that is really used to describe a lot of different things that can be happening in the knee. And what does it look like, or how does it present itself? Well, patellofemoral pain will occur when there's too much pressure on the back of the kneecap, or when the kneecap is tracking in a direction that isn't the proper direction. It'll present itself most times when you've been sitting for a period of time, like sitting at work or sitting in the car, or if you've ever noticed that you've been sitting at the movies or watching a TV show at home and your knee starts to get kind of achy and sore. That's the pressure building up behind the kneecap and causing patellofemoral pain. There are a lot of different reasons why that happens. It'll also occur with activity, so if you're going up and down stairs, or if you're walking, or especially after you go for a run or exercise at the gym, or yoga or Pilates or something, you can start to experience some patellofemoral pain symptoms as well. It'll make things like walking and going up and down stairs difficult, but the way that it'll usually present itself initially is just that soreness, that stiffness, that ache in your knee. That'll progress, it'll turn into a little bit of what we call crepitus, which is cracking and popping and grinding feeling, or you may even get to a point where you hear it. And then you can get to a point where you start to develop what we would call a monster walk syndrome, where your knees are so stiff when you first get up or after activity that it's difficult for you to bend them, again, because of that pain. When you're sitting, for example, or standing, this is what your kneecap should look like. This is the femur, this is the bone that I just showed you. This would be the red object is your kneecap or your patella. And so when you're sitting, it should be straight inside of those, in that groove, or what we call the tunnel. And that way it allows for disbursement of force along the whole bottom side of the kneecap. That reduces the pressure, that reduces the friction and the grinding, etc. Now what will happen sometimes is that your kneecap doesn't sit in the position that it's supposed to. So your kneecap will track off to one side, and it could go left or right. But what happens then is that this sharp area from the femur starts to rub on one very specific part of the kneecap, or this rougher edge of the kneecap starts to rub on the groove, the tunnel. And you'll notice there's no contact down here, and that's what causes the grinding, the cracking, the popping that you feel or hear when you're doing things, and it eventually leads to the pain that you feel. In this last picture, you'll see basically the femur again, and what you'll see is that the kneecap is sliding side to side as you're moving, as you're walking, as you're going up and down stairs. And so you'll get friction here on the kneecap and on the femur, and then as it slides over the other way, you'll get the same thing on the other side. And again, that's what will cause that grinding, that popping, that pain, but it also causes the discomfort. These two are not normal, and they're not what we want to see, but most commonly that is to some degree what we see in people that have patellofemoral pain. If you want to figure out a way to determine whether or not you're at risk for it getting worse, here's a simple test. You're going to get yourself standing on just one leg on the involved side. You're going to make sure that your foot stays flat and your toes stay facing straight ahead. And you're going to slowly squat down, and you want to squat down keeping the other leg up in the air. You're going to slowly squat down, making sure that your knee does not deviate in or out, that your hips don't sway side to side. And so you want to go down about 25 to 30 degrees, and what you're looking for is there any pain, any of that crepitus or cracking or popping or anything like that. Now what it shouldn't look like, as you go down, your knee deviates outward, or your knee should not deviate in that inward direction. If that gives you any symptoms, cracking, popping, stiffness, soreness, pain, if it's difficult for you to do without your knee deviating in one way or the other, give us a call or click on the link below, and we'd be happy to help you figure out what's going on and get things taken care of.